You may have heard that low vitamin B12 levels can cause fatigue, so when you find yourself feeling sluggish, you may think that taking a B12 supplement will boost your energy. But here's a shocking truth. Not everyone should take it. In fact, for some people, it can do more harm than good. I'm a family physician with over 20 years of clinical experience. And today, I am going to tell you everything you need to know about this controversial vitamin and help you decide if you should take it. First things first, what exactly is vitamin B12? Well, it's actually a group of compounds, including cobalamin, that our bodies need for many functions, including making new cells, breaking down certain amino acids, synthesizing DNA and RNA, and helping with the release of energy from other foods we eat. Vitamin B12 is mostly found in animal products like meat, poultry, fish, eggs, and dairy. So if you don't eat any of these, or enough of them, you could end up deficient. Vegans, for example, or people who avoid dairy, may be at higher risk. Plus, as we age, our stomachs produce less acid. We usually get B12 through food or fortified foods like nutritional yeast or non-dairy milk alternatives. Now, why might you want to take a supplement instead of getting it from food? Well, that's not so easy to answer. The problem is that there's no standard amount. It all depends on the individual. For example, taking tons of B12 can mask problems with your thyroid, leaving you stuck with a thyroid condition that's not being treated. It's like trying to fix a leaky roof with a bucket. You're busy patching things up, but you're not fixing the real problem. Some people can safely take up to 1,000 micrograms a day, while others may start feeling funky at 500. It's the best way to know for sure. A blood test can tell you if you're deficient, and you can adjust your diet or supplement regimen accordingly. Just remember, you don't need to test every month or even every year. B12 stays in your system for a long time, so you don't have to rush into things. Or if you've ever recently taken a B12 injection or gotten a B12 shot at the doctor's office, well, the best choice is methylcobalamin, a natural form of B12 that your body can easily use. It's been shown to improve energy, focus, memory, and overall well-being. The recommended dosage for methylcobalamin is usually around 1,000 to 2,500 micrograms per day, which is lower than the typical dosages of synthetic B12 supplements. And watch out for hidden sources of B12 in fortified foods or supplements. But remember, knowledge is power. By learning more about B12 and testing your levels, you can decide if it's right for you and avoid unnecessary treatments or side effects. Don't just blindly follow what everyone else is doing. Take charge of your own health and wellness. If you didn't do it and you enjoy this content, please do share for more great videos. If you're concerned about your B12 levels or suspect you may be deficient, talk to your doctor and figure out the best course of action together. After all, you're the one living in this body. You deserve to understand what's going on and make informed choices that work for you. They can sneak up on you and cause problems if you're not careful. Thanks for tuning in, and until next time, stay healthy and informed. Also, if your blood tests reveal high levels of B12, you're good to go. There's a lot of trial and error involved, and that's not always a good thing. If you take too much and experience side effects, you may assume that it's due to a lack of a different nutrient. Or worse, you could start doubting your body's ability to absorb B12, leading to more tests and potential medical procedures. In fact, B12 deficiency is more common than you might think. Some studies say 10% of the world's population is deficient, with about 30% having insufficient levels. But wait, just because something is common doesn't mean it's harmless. Low B12 can cause problems like anemia, mood swings, blurred vision, memory loss, pale skin, and yes, fatigue. However, most people who think they're fatigued because of low B12 actually need to look elsewhere for the reason. Studies show that only 1 in 5 people who self-diagnose a B12 deficiency actually have one. For the other 4 out of 5, there's another culprit behind their fatigue. So how can you tell if you're really low in B12? Well, a simple blood test can tell you for sure. But let's say you do have a B12 deficiency. Taking a supplement can definitely help. That's where things can get tricky. Even though B12 is considered a vitamin, it's more like a hormone in terms of how our bodies use it. Unlike regular vitamins, B12 isn't something we constantly need throughout life. Our bodies can store large amounts of it in the liver, sometimes up to 1,000 times what's needed daily. Because of this storage, it's not as vital to get it into your system every single day like you do with, say, vitamin C or calcium. These folks need to be careful about taking extra B12 because it can exacerbate their existing problems. Well, as I mentioned earlier, vegans, older adults, and people with digestive issues are at higher risk of B12 deficiency. But that's not all. Anyone who's had weight loss surgery or a part of their stomach removed is also more vulnerable. And if you're taking some medications like metformin for diabetes, your risk of B12 deficiency goes up too. If you're in any of these groups, consider testing your B12 levels first and then supplementing under the guidance of your healthcare provider. People taking certain medications like proton pump inhibitors for heartburn or antacids for indigestion may also want to skip the B12 supplements. That's because these medications can interfere with B12 absorption, so adding more B12 into the mix could make things worse. Because B12 lasts so long in your body, it's possible to get enough with just 1 or 2 servings of B12-rich foods each week. Now, if you're low in B12, that's a different story. But even then, you probably won't notice immediate changes by taking a supplement. That's because B12 stores in your liver can last anywhere from 1 to 4 years. Yep, you heard me right, 4 years. This means that after a few months of taking a supplement, you'll probably see more side effects than benefits. And here's another little-known fact about B12. You can't just pop a pill and call it a day. Your body can't absorb B12 in its supplement form. Unless you have special helpers called intrinsic factors, these helpers are made by your stomach, and they're essential for absorbing B12, especially as we age. Intrinsic factor production decreases, making it harder for older adults to absorb B12 from supplements. That means that as we get older, we may need to rely more on injections or nasal sprays to get enough B12. Or maybe we just need to make sure we're eating plenty of B12-rich foods like fortified breakfast cereals or nutritional yeast. But wait, what if you're not deficient? Should you still take it? Well, remember what I said about B12 being stored in the liver? Having lots of B12 stored up could be a problem too. It turns out that taking too much B12 when you don't need it can cause side effects like acne, anxiety, and even nerve issues in rare cases. Instead of boosting your energy, it could make you feel worse. That's because excess B12 can disrupt the balance of other nutrients in your body, causing imbalances that make you feel off your game. Now, you may be thinking, come on, Dr. Wagner, how much B12 can I take without having problems? Here's another twist. Too much B12 can hide other nutrient deficiencies. Okay, so who shouldn't take extra B12? Well, you should definitely hold off if you're already getting enough B12 from your diet. Now, some people have genetic or other issues that affect how they process B12, known as methylation issues. So that raises the question, who actually needs to take B12? So if you aren't sure whether you need B12 or not, what should you do? Simple. Test your levels. Now, what kind of B12 supplement should you take if you need one? There's a lot of misinformation out there about B12, so it's easy to get swept up in the hype. Remember, you're awesome just the way you are. Hey guys, I hope you're enjoying this content so far, and I hope you subscribed already.